Thank you, Dr.
Thank
Neha Kakkar, Dr. Tuliga Shankar,
thank you.
and those who attend in the session. Good evening, good afternoon, and good morning. This is the 2058th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. NIRAV KHUNT. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself, so that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with anyone who loves homeopathy. The purpose of the forum is to take homeopathy to every home around the world. And let me come to today's guest, and it is none other than Dr. NIRAV KHUNT MD, Homeopathy, and is working as an assistant professor, Department of Homeopathic Material Medica, Rajkot Homeopathic Medical College, Gujarat. We have a lot of faculties from Rajkot Homeopathic Medical College, and Dr. Meera Kunj is coming for the first time tomorrow. Also, we have another doctor from Rajkot Homeopathic Medical College, Dr. Mehta. The principal is very much interested in our forum, and that's why sir is forward sending lot of the gems from the college to our session. So we proudly welcome our guest of the day, NIRAV KHUNT, and Dr. NIRAV KHUNT. Doctor is about to speak efficacy of homeopathic medicine in liver disorders. As you all know, this is a very, very important subject because a lot of cases are coming nowadays with the gastric problem, and most people are having fatty liver, so many liver problems, and so even jaundice and everything are there. So let us see what Dr. NIRAV KHUNT has to say about all these things. So we proudly welcome you back once again, Dr. NIRAV KHUNT. Welcome.
Thank you, sir, for the
Yes.
warm welcome. Am I audible clearly?
Yes, everything audible. Clear.
Okay. I would like to share a screen first.
So you can.
So, good evening, everyone. Myself, Dr. Nirav. I am practicing homeopathy since 6 years and also assistant professor in Rajkot Homeopathic Medical College. So, our today's topic is the efficacy of homeopathic medicine in the liver disorders. So let's the beginning with the this is a timeless principle from the every foundation of the homeopathy and guide us in an approach to the every disease includes the liver disorder which are the rapidly become a major global health concern. The liver, often called the silent laboratory of the body, perform over the 500 vital functions essential for the life. The liver plays a central role in the metabolism, detoxification, and overall homeostasis. However, the modern lifestyle pattern includes the poor diet, alcohol use, sedentary habits, and psychological stress have led to a significant rise in the conditions such as the fatty liver disease, hepatitis, and the cirrhosis. What is particularly concerned is that the many liver disorders are progress silently, often remain undetected until they reach advanced stage. In such a scenario, homeopathy offers a gentle, holistic, and individualized approach. It does not merely target the disease organ, but aim to treat the patient as a whole, addressing the underlying susceptibility and restoring the balance at the physical, mental, and the emotional level. So today's session, the efficacy of homeopathic medicines in liver disorders, I will share a current burden and clinical importance of the liver disease, homeopathic perspective of the hepatic pathology, evidence through the clinical experience and case outcomes, and the scope of individualized homeopathic medicine in effective management of hepatitis. Through the principles laid down by the Samuel Hahnemann, homeopathy aims not just a palliation, but at a true restoration of health by stimulating the body's innate healing capacity. I hope these sessions will provide the meaningful insight and encourage the further exploration in the role of homeopathy in the hepatic care. So I would like to start with the importance of the liver in our body. So how much do you love your liver? I am the largest organ in the body, integrate to most metabolic functions of the body, performing over the 500 tasks only. 10 to 15% of the function is required to sustain a life. Removal of me will resulting in death within 24 hours. Let me tell you how much I love you in a line way. I store the iron reserve you need as well as a lots of vitamins and other minerals. Without me, you wouldn't have a strength to carry on. I make a bile to help digest your food. Without me, you would waste away to nothing. I detoxify the poisonous chemical you give me, and that includes alcohol, beer, wine, drugs, prescribed and over the counter, as well as the illegal substance. Without me, your bad habits would kill you. I store the energy like a battery by soaking pills, sugar, carbohydrates, glucose, and the fat until you need. Without me, your sugar level in your blood would fall dramatically and you would go into the coma. I make the blood that got your system going even before you born. Without me, you wouldn't be here. I manufacture new protein that your body needs to stay healthy and glow. Without me, you wouldn't grow properly. I remove the poisons from your body or air, exhaust, smoke, and chemicals you breathe. Without me, you wouldn't be poisoned by pollutants. I make a clotting factors that stop bleeding when you are accidentally prick yourself. Without me, you would be bleed to death. I help defend you against the germs going into your body all the time. I take those germs, flu, bugs, and other germs you encounter and knock them dead or at least weaken them. Without me, you would be a sitting duck for every infection known to man. That's how much I love you, but do you love me? That means the how we treat the liver, we don't know the importance of the liver and whatever we are eating, we are drinking, that is very important and it also our damage our liver. So don't drown me in a beer, alcohol or a wine. Even one drink is too much for a people. It could scar me for a life. Watchdog drugs, all the drugs are the chemical. When you mix them up without doctor's advice, you could create something poisonous that could damage liver badly. I scar easily, and those scars called the cirrhosis, cirrhosis are the permanent. The medicine sometimes necessary, but taking the pills when they aren't necessary is the bad habits. All those chemicals can really hurt the liver. Be careful with the aerosol spray. Remember, liver have to detoxify what you breathe into. So, when you are cleaning the aerosol cleaner, make sure the room is ventilated or wear a mask that goes double for a bug spray, midwife spray, paint spray, and all those other chemical spray you use. Be careful what you breathe. Watch what gets your skin? Those insecticides you put on a trees and scrubs not only the kill bugs, but they can to the liver right through your skin, destroy the liver cells too. Remember, they all are the chemicals cover your skin with the gloves, long sleeves, hat, mask, everything time insecticide are in the air on your handling of them. Warning: liver can't and won't tell you uh, tell you that it is in trouble until liver at the most end of the rope. Remember, the liver is a non-complainer. Overloading liver with drugs, alcohol, and other junks can destroy you. This may be the only warning you will ever get. Now, I would like to start with the burden and the distribution of the liver disease. Burden and the prevalence, we talks about the worldwide as well as the India. The world organizations provide the global data showing that the disease are the major public health concern worldwide. Liver disease causes the 2 billion deaths per year globally, count for about 4% of all deaths worldwide. Major causes the cirrhosis, hepatitis viral, hepatitis B and C, liver cancer that is called the hepatocellular carcinoma, hepatitis B, 296 million people living with the chronic hepatitis B virus infection causes the 8,20,000 deaths per year, spread via blood, sexual contact, and the prenatal transmission. Hepatitis C, 58 million people infected globally, causes the 2,90,000 deaths per year, mainly transmitted through the unsafe injection and the blood exposure. Alcohol-related liver disease, major contribution to the liver cirrhosis worldwide, responsible for the large proportion of the liver-related death, increased the trend in developing countries especially. Non-alcoholic fatty liver disease affect about 25% of the global population, strongly associated with obesity, diabetes, and the sedentary lifestyles. Liver cancer, hepatocellular carcinoma, sixth most common cancer globally, third leading cause of the cancer death, major risk that is a chronic HBV and HCV infection, that is the hepatitis B virus and hepatitis C virus infection, alcohol and non-alcoholic fatty liver disease. Now we talks about all over burden in India. Liver causes the account for 80 to 20 lakhs deaths per year in India. Amongst the top 10 cause of death in India, majority cause occurs in productive age group 30 to 60 years. This is the major loss for a country. Non-alcoholic fatty liver disease prevalence 9 to 32% in general populations, up to 60 to 70% in the diabetic and obese individuals. Rapidly increased due to the sedentary lifestyle, junk food consumption, and urbanization. The people more and more comes towards the city, and irregular food habits and irregular drink habits all the affect and damage our liver. Now become the leading cause of the liver disease in the India. Alcohol-related liver disease responsible for the 20 to 30% of the liver cirrhosis cases. Increased trend among young adults, strong link with the chronic alcohol consumption, malnutrition are the major cause. Now we talks about the major risk factor for the liver disorder. The first one is the viral infection, the most important cause. The hepatitis B and the C are the leading cause, spreading through unsafe injections, blood transfusions, unprotected sexual contact, mother to child transmission, major cause of the liver cirrhosis and leads to the liver cancer. Now the second point is the alcohol consumption, one of the top cause of the liver cirrhosis. Risk increase with the durations and quantity. Durations means the how years of drinking, how long you are drinking the alcohol, and quantity is also important. How much you are drinking the alcohol is also important factor for the liver damage. Unhealthy lifestyle, high fat, junk food diet, lack of physical activity, and the obesity are the major cause. Leads to the non-alcoholic fatty liver disease, diabetic and metabolic syndrome. Strongly linked with the fatty liver includes the diabetes, high cholesterol, and the hypertension. Leads to the liver disease, liver damage. Increase the risk for the fatty liver disease, which leads to the liver cirrhosis. Drug-induced liver injuries, long-term or improper use of painkillers, antibiotics, and herbal alternatives medicines if misused, which is usually we see in India, the people are taking the medicines directly from the medical store without the prescription, and sometimes taking the pills unnecessarily, which is damage our liver badly because of the regular habits of painkillers, such are dangerous for the liver. Toxins and environmental factors, exposure to the industrial chemicals and contaminated food associated with the liver cancer risk. We usually see the industrial workers who work in the biggest industries and chemical industries. usually do not wear gloves, do not wear a mask, which is affect the liver gradually. Now, let us say about major cause and common cause of the liver, which is the fatty liver disease. So, what is the fatty liver disease? That is, the fatty liver is the collection of excessive amount of fat inside the liver cell, also called the steatosis. Mostly the triglyceride are accumulated upon the liver. Common type of the fatty liver disease, that is the non-alcoholic fatty liver disease, affected people who drink little or no alcohol. Simple fat or steatosis usually causes the no liver damage. Major cause behind non-alcoholic fatty liver disease, that is the obesity, especially a central obesity, which means the fat accumulations around the abdominal region. The excess body fat increase the fat depositions in the liver. Abdominal fat is the more harmful. Unhealthy diets, high intake of refined carbohydrates, white bread and sugar, saturated fats and trans fat, junk and processed food. It also damages the liver badly. Sedentary lifestyles, lack of physical activities leads to the reduced the fat burning, leads to the weight gain and insulin resistance. We can usually see in our office workers who have habits to sit continuously and overall the day, the lack of physical activities leads to the liver damage, as well as so many other concerned diseases like diabetes, hypertension leads to the liver damage. Genetic predispositions, family history, increase the risk. Certain genes variant promote the fat accumulation surrounding the liver. Now we talks about the pathogenesis of the fatty liver disease. The first is the insulin register key starting point. Most important mechanism seen in obesity, type 2 diabetes, and the metabolic syndrome causes the increase in the lipolysis in adipose tissue, increase the free fatty acid reaching to the liver, and also decrease the glucose uptake, which leads to the hyperglycemia, resulting in liver gets overloaded with the fat. Second thing, the increase the fat accumulations in the liver, fat building up due to increase the free fatty acid reflux from the adipose tissue, increase the de novo lipogenesis, that means the new fat formation in the liver, reduces the fat oxidation. Mitochondrial dysfunction reduces the very low density lipoprotein export from the liver, resulting in hepatic steatosis that leads to the fatty liver. Oxidative stress and the lipotoxicity. Excess of fat undergoes the oxidation, produce the reactive oxygen species (ROS), leads to the lipid peroxidation, mitochondrial damage, and cellular injury, which leads to the resulting in liver cell damage. And the fourth one is inflammations. The damaged hepatocytes release the signal activations of the Kupffer cells, liver macrophages, and the cytokines TNF alpha and interleukin 6, resulting in non-alcoholic steatohepatitis. And then after leads to the fibrosis formation, chronic inflammations, activations of stetal cells, collagen depositions, resulting in the fibrosis may progress to the cirrhosis, and may cirrhosis progress to the liver cancer. In advanced stages, risk of the hepatocellular carcinoma. What are the symptoms of non-alcoholic fatty liver disease? In an early stage, there is no symptoms in the most of the cases. Mild fatigue sometimes present and discomfort in the upper abdomen. Non-alcoholic liver steatohepatitis, the persistent fatigue, mild pain in the liver area, and enlarged liver. And in advanced stages, when the fibrosis or the cirrhosis happens, the time the jaundice, fluid accumulation that calls ascites, weight loss, and the muscles wasting can be present. Now, the second type is the alcoholic steatohepatitis, a more serious type, causes the hepatitis infections, malnutrition, obesity, and diabetes. In some cases, this can progress either to the cirrhosis, which can produce the progressive irreversible liver scarring, or to the liver cancer. So the pathogenesis of the alcoholic liver disease, ethanol metabolism in the liver. Alcohol is the mainly metabolized in the liver by alcohol dehydrogenase, microsomal ethanol oxidation system. Ethanol converts into acetaldehyde, and acetaldehyde is the acetate. Increase the NADH or NAD plus ratio. Ethanol metabolism produces the excessive NADH. NADH means with nicotinamide adenine dinucleotide. Affects the reduces the fatty acid oxidation and increase the fat synthesis, resulting in fat accumulation in the hepatocyte. Acetaldehyde toxicity. Acetaldehyde binds the protein from adducts, causes the mitochondrial damage, impair protein functions, resulting in hepatocyte injuries. Yeah, so hepatocyte cell injuries. And after that, the oxidative stress leads to the inflammation. Inflammation leads to progressive inflammation, or the continuous inflammation leads to the fibrosis. Fibrosis converts into the liver cirrhosis, as we've seen in the non-alcoholic liver disease. What are the symptoms of alcoholic fatty liver disease? In early stage, often no symptoms, fatigue and mild liver enlargement seen in an early stage. Progressive stage, alcoholic hepatitis, fever, jaundice, yellowness of the skin and conjunctiva, abdominal pain, vomiting, and the loss of appetite. In advanced stages of the cirrhosis, swelling of abdomen called ascites, leg swelling, easily bruising or bleeding, confusion leads to the confusion due to the hepatic encephalopathy. Now, what we suggest the blood investigation, especially in a fatty liver disease. So the blood investigations, liver function test, LFT or as we know, SGPT usually we can see higher in the fatty liver disease. SGOT is usually high. Bilirubin usually normal in the early stages, but in advanced stages it can be also high. Alkaline phosphate is mildly high, you can see in fatty liver disease. Now metabolic profile, fasting blood sugar and HbA1c we can suggest to the patient. Lipid profile, usually we see increased triglyceride and the all over cholesterol. Insulin resistance markers can be also altered in a fatty liver disease. Important because the fatty liver is a part of the metabolic syndromes. Viral markers rule out the other cases. So we can diagnose the hepatitis B and hepatitis C through the HbS-AG and anti-HCV. Imaging studies, the most important. Ultrasound abdomen is the first line we usually diagnose with the case from the US usually in a clinical practice. Increase the echogenicity, bright liver we can see, hepatomegaly we can see, cheap, non-invasive and widely used ultrasound. Fibroscan, transient elastography, we can also call the ultrasound type of ultrasound, which is based on because measurement of the liver stiffness, we can use the fibroscan, which help us in a stage of the liver, fatty liver disease. We can measure to the mild, moderate, or the severe fibrosis. Liver biopsy, which is the gold standard, confirm the fat accumulation, inflammations, and the fibrosis, but invasive proper and routinely not done. Okay. But whenever the case is, we have to want an accurate result and we cannot get anything from the USG, we can go for the liver biopsy. And sometimes we have to rule out the hepatocarcinoma. That time we can go for the biopsy also. Now, dietary advices for the liver disease patient. General principle, eat small, frequent meal every 3 to 4 hourly because sometimes people have habits to consume lots of food at a time, which leads to a load over the liver. So advise him to frequent meal and small meal. Maintain the healthy weight, avoid the rapid weight loss, prefer the fresh homemade food, avoid the overeating and late night meals, high fiber diet, oats, brown rice, whole wheat, fruits like apple, papaya, banana, vegetable like the spinach and broccoli we can suggest to patient, which help fat metabolism and detox as a supporter. Hydration, 2.5 to 3 liters water daily, coconut water and buttermilk we can advise, and lemon water is also best for the liver. Food to avoid, that is very important for the patient who suffering from the grade 1, grade 2 fatty liver disease. Fast food and bakery items can cause the fat accumulations in the liver, so totally avoid that food. Excess salt, especially in the cirrhosis. Avoid pickles, papad, processed food helps to prevent ascites, fluid accumulations around the abdominal cavity. Fatty liver disease, weight reductions 5 to 10%. Avoid sugar and refined carbs. Increase the exercise for fiber diet intake. And the cirrhosis, high protein, unless hepatic encephalopathy develop, and the low salt diet we can suggest to the patient. In a hepatitis, soft, easily digestible food we can advise patient try to avoid the milk, butter, cheese, that type of food which is take a time in the digestion. We advise to patient to avoid that food. Avoid the oily and spicy food also, and take high fluid plus the vitamins. Now we see the miasmatic evolutions in the liver disease. So it start with the SORA because the from the healthy liver to the liver cirrhosis, there is a progressions of the soric, psychotic, and syphilitic phases. The first phase is the soric state. There is a functional disturbance are there, and the pathology which develops the functional disturbance without the structural damage, mild hepatic congestions, early fatty infiltration. Symptoms we can see in the patient: indigestions, bloating, mild diet, hypochondriac discomfort, irregular appetite, and the constipations in the soric phase. Now, second one is psychotic phase, when the infiltrations and overgrowth we can see. The pathology, fat accumulation, steatosis, hepatomegaly we can see, enlargement of the liver, and the water retention, which leads to the ascites. The symptoms reflect by the patient: heaviness in the abdomen, obesity or weight gain, sluggish digestion, and thickening the tissues. Third one is the syphilitic state. We also know that the destruction and degeneration state. When the pathology leads to as the peak level or the gross pathology develops, that stage we can see the syphilitic phase. The pathology seems we have fibrosis and the cirrhosis, liver cell destructions, and the portal hypertensions we can see in this stage. The symptoms are the jaundice, ascites, hemorrhage, and severe weakness. Now we talks about a few homeopathic medicines which is we frequently use in a clinical practice. We all know about the chelidonium, or the first river medicine we can say. The key indications of the chelidonium is that the right-sided liver pain radiated to the right shoulder blades. Also, other symptoms are the jaundice, fatty liver with the sluggish digestion, desire for hot drinks, one of the best liver remedy. Second one is the cardias marianus. Cardias marianus medicines best we can prescribe while the patient having the history of alcohol. The key indications: the fatty liver, especially the alcoholic, enlarged liver, portal congestion, history of alcohol use. The medicine act as a liver tonic. Lycopodium, we know the lycopodium. If we talks about the personality regarding the lycopodium, so usually we see that Lycopodium is a cowardice, avoid the responsibilities, low self-esteem, anticipatory anxiety we can also see in a patient, anxious about the health, about the career, and the performance anxiety is the core of the lycopodium we can see usually in this personality. The key indications are the goish, bloating, towards the evening at 4 to 8 p.m. Even eating a little causes the fullness in the abdomen. Or we can see the fullness in the abdomen, especially the lower abdomen affection in the lycopodium. Right-sided complaint usually, chronic liver disorders and the constipations. As usual, craving for a sweet and hot drinks in the excess may be present in a lycopodium. Now, second medicine is the nux vomica. If we talk about the nux vomica personality, that is the intellectual, ambitious towards the work and the perfectionist, bossy nature, angry, impatient, oversensitive, and the fear of poverty we can see. And if we talks about the nux vomica personality, we know that the sedentary habits and whenever the disease start with the sedentary habits, our the first choice is the nux vomica, a disease like indigestions, constipations, and any kind of GIT disease as well as the liver-related disease. We can choose the nux vomica as a first choice. Liver issues due to the alcohol, spicy food, sedentary lifestyles, irritability and anger we can see in a nux vomica patient. A very significant symptoms for the selection nux vomica for the fatty liver disease is the constipation with ineffectual urge to pass a stool or a poop. The stool, however, is insufficient and unsatisfactory. Patients usually want to go stool frequently, and whenever we ask, the patient says it is totally unsatisfactory. Best for the modern lifestyle disease. Also, we see that patient usually have irregular food habits, irregular time of the sleep, late night parties. That type of personality usually we can prescribe the nux vomica. Or the next medicines is phosphorus. If we talks about the personality regarding the phosphorus, usually we see that is extrovert personality, great loquacity, fearful personality, usually fear of darkness, fear of ghosts, and craves for the company. If we talks about the key indications of the phosphorus, that is the fatty liver degenerations of the liver, cirrhosis tendency, bleeding disorders, weak sensitive patient. The craving for the particular things in a diet is the important indications for the using this medicine. In the liver patient, those particular thing includes the ice cream, cold drinks, and the refreshing things and items like a juice are also desired for the phosphorus patient. Or the next medicine is the natrum sulph. Natrum sulph, we know that medicine used usually for the respiratory complaints. And the key indications that is we can prescribe the medicine whenever the complaints start with the damp, rainy, and cloudy weather. If we talks about the personality, the best medicines for the bad effect after the head injury. The suicidal tendency we can also see in the natrum sulph personalities. The patient usually a close, serious, and responsible, and dreams of the frightful dreams we can see in a natrum sulph personality. Our next medicine is the sulfur. The sulfur, if we talks about the personality regarding the sulfur is the selfish, egotism, intellectual, philosophical, and theorizing person. The philosophical mania we can see in a sulfur personalities, which is usually a lazy person, dirty person. Standing is the worst position for the sulfur. Sulfur we can see that is a antipsoric medicine, so we can use as a antimiasmatic also. The key indications of the sulfur that are the chronic liver disorders, heat and burning sensation, skin issue with the liver problem, and in that type of conditions we can prescribe. If we talks about the bryonia, if the personalities we can say they are the very irritable personality, talks about the business, fear of poverty, dread of future, and reserve type of personality. Medicine usually belongs to the Cucurbitaceae family. If we talks about the key indications, when there are the stitching pain in the right hypochondriac region, bryonia, the liver is swollen, congested, and inflamed. The pain in the hypochondriac regions are worse from the motion and better from lying on right side. It is the chief medicines for the jaundice brought on by the fit of anger. This is the keynote of the bryonia. Our second medicine is Mercurius. If we talks about the Mercurius personality, usually we can see there is introvert personalities having a violent impulse to kill someone, suicidal and homicidal tendencies. Great anti-syphilitic medicine. So whenever our disease progress towards the syphilitic miasms, we can prescribe the Mercurius. A patient we can see they usually hurried, rapid in the talking, and the weak memory we can see in the personalities of Mercurius. This has a much sensitiveness and the dull pain in the region of the liver. The patient cannot lie on the right side. The liver is enlarged. The skin and the conjunctiva are the yellow. The stool are either a clay color from the absence of bile or a yellowish or a greenish color sometimes due to the bilious. There are the yellowishness, white coated tongue, which take the imprint of the teeth, and there is a fetid breath, loss of appetite, and the depression of the spirit we can see in Mercurius personalities. Next, very important medicines, which is the podophyllum. The principal use of the podophyllum in the liver disaffections. Primarily, it includes the large flow of bile, and secondly, the great torpidity, followed by the jaundice. It is the indicator in the torpid and chronically congested liver. When the diarrhea is present, the liver is the swollen and the sensitive, the face and the eye are yellow. There is a bad taste in the mouth. The tongue is coated white or yellow sometimes. Next medicine is the digitalis. We know the digitalis we use with cardiac affections, but the when the jaundice arises from the cardiac disease, the digitalis may be the remedy. There is no retention of bile nor obstruction of the duct, but the jaundice due to the fact that the liver does not take from the blood the elements which go to from the bile. There is a present drowsiness, bitter taste, soreness, enlargement, and bruise filling in the region of the liver. If we talk about some rare homeopathic medicines for the liver disease, which we are not usually practicing in our day-to-day life, Uh, first one is the andrographic paniculata, the strong hepatic protective remedy useful usually in a fatty liver, hepatomegaly, and the viral hepatitis, act on a liver inflammation and detoxification. Second one is a Fumaria officinalis, a rare but important liver drainage remedy. Indication especially in a liver plus skin affections, especially eczema, bilious constitution mentioned in a liver drainage therapeutics. Saponaria officinalis, one of the best medicines for the liver affections, especially the chronic liver congestion, portal system sluggishness, useful in a cirrhotic tendency of the liver. Leptendra, which is used especially in a black terry stool and liver sluggishness. And dolichos. The key indications of the dolichos, the intense itching without eruption associated with the liver dysfunction or jaundice. Okay, so now we talks about few cases. Case one, there is a patient, 42-year male, build is average occupation, working professionals, marital status is married. The history of presenting complaint, the patient was accidentally diagnosed with the grade 2 fatty liver during the routine checkup. No major liver related symptoms initially, and if we talk about my personal experience, I usually seen a patient who do not know about the liver affections. We accidentally usually found in a fatty liver 1 and fatty liver grade 2 disease, while we are suppose sent to the patient for the USG for another complaint, and patient diagnosed with the fatty liver disease sometimes. Mild abdominal discomfort present occasionally, main suffering, the progressive anxiety, and the mental distress. So causation, etiology, the symptoms began after the diagnosis with the stage 3 breast cancer by mother, emotional shock plus ongoing chemotherapy stress, mental generals, the severe anxiety about health, fear of future, financial instability, instability to support family, anxiety, disappropriations to the complaint, even a mild pain or a mild complaint, patient leads towards the panic. Overwhelmed by the responsibilities, confusion and absent-mindedness, lack of enthusiasm, mental dullness, regret feeling. Regret feeling patient says, why is this happening to me? Physical generals, appetite normal, slightest reduced due to the stress. Thirst is a moderate, patient is chilly, perspiration sometimes increase, especially in a head. Sleep disturbed due to the anxiety, and stool is normal. If we talk about the totality, so mental symptoms are included the anxiety about the health and the future, fear of financial insecurities, overwhelmed by the responsibilities, confusion, absent-minded, lack of enthusiasm. Physically, patient is chilly, perspiration on head usually, and particular mild abdominal discomfort. My final remedy was the calcarea carb, a case of grade 2 fatty liver disease, the predominantly anxiety neurosis triggered by the emotional stress was successfully managed with the individualized homeopathic treatment using the calcarea carb, resulting in improvement in the both mental aspect as well as liver functions. This is the follow-up. In the first follow-up, there is a sleep disturbance due to the stress is as usual. Appetite is reduced gradually. Abdominal heaviness after overeating. I prescribed the single dose of the Calcarea Carb 200. On the next follow-up, he gave me a news that her mother was expired due to the breast cancer, and the complaints also abdominal heaviness is SQ, and the appetite is also SQ, and symptoms of frightful dreams, and due to the frightful dreams, sleep is usually disturbed. So I raised the potency from Calcarea Carb 200 to 1 m, a single dose, and then after next follow the sleep is improved, sometimes disturbed, the abdominal heaviness improve also, and appetite is also improved. You can see the patient's outcome before after results. You can clearly see the SGOT and SGPT changes, and the ALT also the rise, and after the treatment they are usually reduces, and also the ultrasound are present. So in a first before the treatment there is a diagnosed with the fatty liver grade 2, and then after the mild fatty changes. So I usually seen in a patient with a fatty liver 1 grade 1 and grade 2 can usually reversible with the right choice of the medicine and also dietary advices. I would like to present a second case. The female patient, 53-year occupation is a homemaker, marital status is the married. Patient come with the chief complaint, complaint started gradually 4 to 5 months back. Pain is a dull dragging type of, more in the abdomen, marked heaviness after eating small quantity, bloating and flatulence present. Complaint worse after a sleep and relief after a passing of platters. Talks about the mental journals. A very talkative patients jump from one topic to another, cannot stick to one answer. Loquacity is the mark. Religious mania, constantly speak about the God, dreams of God during the case taking, everything relate with the God. desire company but dominate conversation. If we talk about the physical generals, the appetite reduced to the heaviness. Thirst is the moderate. Thermally, patient is hot. Perspiration is normal. Sleep disturb, aggravations after a sleep. Stool, irregular tendency to constipation. And patient also known case of hypertension since 10 years and taking allopathic medicines regularly. Totality of the symptoms, patient is a talkative, loquacious. Religious mania talks about the gods, dreams, jump from the topic to topic. Physical generals, there is a hot patient, worse after a sleep, particularly the abdominal heaviness after eating, bloating, and indigestions, relief after the passing a splatters. My final choice of medicine is the lacasis. After the medicine, patient symptoms gradually settle down, resulting in significant improvement in the liver function and also reduces the triglyceride. This is the reports of the patient and final outcome. Patient having alteration, we can see in SGOT and SGPT, and also patient's cholesterol. Total cholesterol is high and triglyceride is also high. After the treatment, patient all over the symptoms improve, weakness improves, digestion improves, energy level improves, and overall weight, overgaining weight, it is also decreased. And most importantly, her cholesterol is also dramatically down from 265 to 192. This is the follow-up. From the first follow-up, abdominal heaviness as usual. Appetite is as you sleep mildly improve and constipation sometimes. I prescribe the Lacasis 200 again, one dose. On the next follow-up, abdominal heaviness reduced is mild. Appetite as usual. Weakness present, physical exertions while only. Constipation SQ. And indigestion sometimes patients say while overeating and all type of food, that time indigestion occurs. I also I again repeat the Lacasis 201 dose. On the next follow-up, abdominal pain improves, appetite improves, constipation on and off sometimes. Digestions only while after taking the heavy foods only. So I put the patient on SL. Thank you so much for your attention. And I would like to say that yesterday was the 19th April is the World Liver Day. So belated happy World Liver Day, all of you. Thank you.
Thank you. Thank you, Dr. NIRAV KHUNT.
Thank you,
It
sir. And
is,
thank you, sir, for giving the stage to share some knowledge. Thank you,
yes,
Danesh, sir, and the team.
yes, you really rock the floor with your exemplary knowledge in that particular area. And you have suggested the medicine, suppose medicine, but all in all, in the last part, that is the case taking and the presentation of the case, we find that entirely different medicine coming. That is what is homeopathy. No specific medicine for a particular disease, but
Yes, right.
treat the patient and not the disease. That's the reason why you got calcarea carb. And that uh, when you take the case in brief, you find that the patient is having entirely different symptomatology, and even though the symptoms common to the disease is the same, but the mental as well as the other physical aspect is different. So that's the reason why you were able to choose another medicine for that. Anyway, congratulations. And there is very big scope for us, because in this field, if you people concentrate more on treating this kind of patients, definitely you will have a good name, and you will be able to move forward with a good number of patients also.
Yes,
Okay.
sir.
Whether you are having practice, private practice in your
Yes, I'm doing the private practice in my clinic since
how's it?
6 years.
How long since you are practicing?
So since 6 years I am with practice.
Okay. Uh, what is the present situation in your area with homeopathy?
Presently, we see the lots of patients regarding. I already told you, okay, whenever the patients come to us for the other complaint, but accidentally diagnosed with the liver complaint usually, because in the starting phases in a fatty liver 1 and fatty liver 2, grade 2, that time the patient is usually not aware about this because the liver is usually not giving the symptoms. That's why or more or less many patients come to the homeopathy practice for the usually we can see the skin patients more which scope of the homeopathy not in a allopathic system side or other system side of the medicine. That type of patient usually come to the clinic.
Yes, that's a very good thing. If anybody want to participate in discussion, you can raise your hand so that we will allow you to unmute yourself. Dr. Rakshis Vishprara, do you want to speak to Dr. Nida? Please unmute yourself.
Yes.
If you want to speak, please unmute yourself and you can speak. Then, yes, Dr. Ambesh sir is always ready, so you can speak now. Please unmute.
Thank you, Dr. Dhanesh ji, and congratulations, Dr. NIRAV KHUNT.
Thank you, sir.
Very nice presentation. Very good describe the liver disorder and fatty liver. Case presentation, fatty liver according to symptom, calcarea carb, select remedy, and lycasis. So, would select remedy according to case taking. Case taking is the important.
Okay.
Case taking जो है mental, physical and general and modality important role and treat of miasmatic angle of treatment. First जो है symptomological angle according to symptom, treat the patient, not the disease. And second, mathematical angle, very important. Chronic case, fatty liver, mathematical angle, treatment, sura, psychotic and syphilitic. Fatty liver is sura plus psychotic miasm.
Yes.
And destructive nature, cancer is the syphilitic miasm. So mathematical remedy is the very important. Suriname, sulfur, medorinum.
Yes.
So king of antis, soric remedy, the functional disorder, jaundice, etc. So chelidonium, cardus. Chelidonium is the very good remedy.
Yes.
And king of antisoric remedy, sulfur. Then queen of antisoric remedy, Suriname.
Suriname, yes.
King of antipsychotic remedy, Thuja.
Tuja. Yes.
Queen of antipsychotic remedy, Medorin. King of antisyphilitic remedy, Merksol. Nosol remedy, king of antisyphilitic remedy, Syphilinum.
Yes.
Diathesis, role of diathesis, cancer diathesis, tubercular diathesis, lifestyle. So, very thanks. Very good describe the fatty liver case taking. So, thank you. Very thanks.
Thank you.
Dr. NIRAV ji, Ghar Homeopathy, Ghar Homeopathy.
Thank you, sir. Thank you.
Dr. NIRAV, what I have noted is that since you started teaching in a college, but still not a single student joined from your college, what was the reason? Why the students are not interested in homeopathy? Or because Gujarat is supposed to be one of the state which is having more number of colleges, that is 46 homeopathic medical colleges. but still not a single student joined in this session.
No,
Why
we
you
cannot
didn't
say
join?
that not interest in the homeopathy, but maybe due to the timing settlement, they cannot join us.
But you could have invite them personally that
Yes,
you
yes,
know,
definitely, definitely. From
and
the
this
next time, I will mark this point.
but
Definitely.
this is how they can study homeopathy and
Yes,
become more and more uh, they can have more and more confidence in themselves. See what other doctors are doing. So
yes,
this is what I have noticed from most of the college professors and teachers. Only very few doctors who are coming with a large number of students as because they are having very good practice. That may be the reason. The students always students respect a teacher or a professor when he is having very good number of patients and is famous for not only in teaching but also in treating patients.
practicing.
And so
Yes,
hope you will concentrate more on your private practice rather than this thing because we need homeopathic professionals rather
right.
than professors. Because simply that's good. You can add professor in front of your name, but the more and more uh, we would like to know as a doctor than anything else. What's your
Right.
opinion on
So definitely, you
that?
are right.
So if you concentrate in that end, you can become one of the famous from Gujarat.
Yes,
Dr.
yes,
Binoy,
definitely.
you can speak something and then you can say vote of thanks as a session also.
Okay.
Yes, yes,
Yes,
Wonderful
definitely.
session,
yes.
and it talks about you demonstrated the importance of liver in all aspects of human body and the human survival. Basically, it was very demonstrative and very educational session. And you also mentioned all those key remedies that can help in the liver cirrhosis and liver related issues. It helps all the participants and all the IFPH community. And I have one quick question for you. Uh,
Yes.
in your case that had the calcarea carb remedy, you mentioned from calcarea carb 30, you upgraded to calcarea carb, or no, calcarea carb 200 to calcarea carb 1M. What exactly the stage where you switched the remedy from 200 to 1M? What
Okay.
exactly?
As I mentioned in the case, there is the more towards the mental aspect case.
Okay.
Main the complaint start when her mother diagnosed with the stage 3 cancer. Okay, and the first follow up there all are the symptoms are the same, and the next follow up she told me that her mother gone due to the breast cancer, and that's why the patient become more depressed and all the symptoms are worse, especially the mental symptoms are the worst. So whenever we are prescribing the only a mental aspect, so usually I thought higher potency is the right choice in this scenario. So that's
Okay.
why I choose the upgrade potency.
Thank you, doctor. I just want to make sure that's clarified. Thank you very
Yeah,
much, and
thank
thank
you.
you for the great presentation. Thank you from all the participants' perspective and IFPH perspective. Thank you very much.
Thank you, sir. Thank
Goes back to Dr. Danish.
Thank
Dr. Danish,
Thank you, Dr. Binoy. And tomorrow we will have a session from another doctor from the same college, that is Dr. Janki Hepara, and she will be talking about urticaria unveiled and a deep dive into the psychological triggers and homeopathic healing. So thank you, Dr. NIRAV KHUNT and Dr. Ambaresh sir, Dr. Binoy, and those who attend the session in this evening. Thank you all.
Thank you, sir.
Good night.
Good night.
Over to Dr. P. Shaila to moderate the Malayalam session. No, Dr. Mariamma Job.